Good day. I am Mr. John Ludwiguez Ocampo. I am working as a staff nurse in male surgical ward, and today I'm going to discuss to you the MEWS policy. Nowadays, we have an increased influx of patients, acute or chronic conditions or cases. These patients requires a quality holistic care, isn't it? And for us to deliver a quality holistic nursing care to our patients, a nurse must possess the following characteristics. Number one is a good assessment skill. A nurse must know how to assess the patients because with the good assessments, you can formulate a good nursing diagnosis, and at the same time, you can think of a good interventions that is intended for your patients. Now, secondly, a nurse must possess a good communication skills. Remember that communication is essential to our work, especially when we are endorsing one patient to another staff on duty or to other department. We are using the S-bar nowadays. And also, when we are communicating with the other members of the healthcare team. And lastly, a nurse must have a good nursing judgment and a critical thinking. Remember that when we are formulating nursing diagnosis, we must know also what are the necessary actions that we need to provide to our patient. Agree? So there you have it. So now I'm going to discuss to you our policy for MEWS, or what we call the Modified Early Warning Score. The Modified Early Warning Score is a document written that is used to provide the staff nurse with a clear framework for the identification and management of the patient that is at risk for physiological deterioration. This policy is applicable only for the adult patients above 12 years old. MEWS was developed with three specific aims. Number one is to facilitate timely recognition of the patients with impending or established critical illness. Number two is to empower nurses to facilitate timely score review. And last but certainly not the least, it is a cost-effective measure. MEWS will be applied on both medical and surgical wards admission to facilitate the early detection of clinical deterioration and develop a potential high care plan. MEWS was adopted from the early warning score system, which is used as a guide by the medical services, including nurses, to determine the degree of the illness of the bedside patients. It is based on a simple scoring system in which a score is allocated from the physiological measurements. Those measurements are used to come up with the overall condition to formulate a high care plan management. Just a brief history. The first recorded early warning score system was developed by a team in a James Paget University Hospital in Norfolk, United Kingdom, and was presented at the May 1997 conference of the Intensive Care Society. And now we're heading to the most exciting part, which is how to calculate the Modified Early Warning Score system. Number one is physiological measurement, or your vital signs observation recorded at the time of patient admission or initial assessment, and then continuous procedure till the patient is discharged. The physiological observation records are the level of consciousness using the AVPU, the temperature, then your heart rate, and followed by the blood pressure and the respiratory rate, and lastly will be the oxygen saturation. Second, record all 6 physiological measurements on the vital signs chart in Al-Shifa program. After the record entering in Al-Shifa program, the MEWS score automatically will appear on the screen. The frequency of observation should be increased or decreased as indicated by clinical need by the nurse responsible for the patient. Staff caring for patients and using the MEWS should have competencies in monitoring measurement and interpretation of observations and respond promptly to the acute ill patient, appropriate the level of care they are providing. Then, the total score to give an overall MEWS score. Then, Use the total score to direct clinical action using the management pathway guidelines as follows. But always remember that regardless of the overall result, the patient is likely to receive a high level of care. Let's proceed to each MEWS score and its management. First is MEWS score of 0. If this score appears, the nurse should continue MEWS monitoring with every set of observation. And on the other hand, if the patient has a score of MEWS 1 to 3, the nurse should perform 1 to 2 hourly observation. Then, calculate MEWS each time and inform the shift in charge or the nurse in charge. And if in the case that the patient has a score of 4 to 6, the shift nurse or the in charge should assess the patient. Secondly, you have to activate the rapid response team immediately. Critical care in an environment with a monitoring facilities is a must. And if in case that the rapid response team did not attend within 30 minutes, the concerned doctor should see or attend the patient. The rapid response team consists of the intensivist or the anesthetist, then the senior ICU staff nurse, and the respiratory therapist. And to activate the rapid response team, you have to dial 2074. Remember those number, 2074. The assigned staff nurse should do or initiate the call and should mention the name of the ward, the room number, and the bed number. Furthermore, the assigned staff nurse should fill up the rapid response team monitoring checklist. Then, the rapid response team is expected to reach within 5 minutes after the activation. And if the patient has a score of more than 7, the nurse should activate the rapid response team immediately. Then, an emergency assessment must be conducted by the on-call doctor. Then, the patient must be considered or will be transferred immediately to the higher level of care or in the high dependency unit and or in ICU. Bear in your mind that when you are communicating about a deteriorating patients to the other healthcare professionals, you should use an SBAR communication to facilitate a concise and effective dialogue. On the other hand, all the patients with a MEWS score of more than 4 should have an alert doctor. Then lastly, all the patients with MEWS score of 4 and above must be always a part of the handover process of both medical and nursing staff. That's all for today, guys. Thank you so much for your attention, and also I hope that it will be a part of your nursing practice. And also, I hope that you will follow and be compliant with the hospital policy as we provide a quality holistic nursing care to our patient. Thank you and more power.